Hi, my name is Dr. Srinivas. I'm the principal dentist of Hills Dental Design. Thanks for joining in. So, I've decided to run a few webinars to give you some more information about the topics you like. So, if you are watching this, please say hello so I know you're there, and also to encourage me to do more webinars. So today's topic was if you have a missing tooth, what are your options? So type in if you have a missing tooth, say yes or no. So I know, if you are this for yourself or for someone else. So I'm just going to show you some models. And then go through the options with you. So for example, here we've got missing teeth. Now the missing teeth is just here. That's a little cast there. So I hope you can see it. And we've got the missing front teeth. So one of the options to what we can do is we can actually do a denture. So for example, this is a denture. Now this does not have any teeth, but this is a metal and it just sits on top and it clicks on. Okay, so let's just make sure that it clicks. There you go. So that's, that clicks onto your teeth, and then you'll have some teeth here. So that's called a denture. Okay, now the other option is a bridge. So what is a bridge? So basically what we do is we prepare the teeth on either side. So say for example, this is a missing tooth there, and here we prep the teeth on either side, and then we put a bridge in, which is exactly like that, and then it just glues on. So there you go, that glues on. All right, and the last one is an implant. Now I'm sure there's a lot of interest in implant these days, especially now in Australia that it's more affordable. People want to know, how can I have an implant? So implant, basically that's an implant where you have the root of the tooth there, that's a titanium pin, and then you've got a crown on the top. Okay, so that the whole thing is an implant. So a lot of the times people ask us, oh, how much does it cost, for example, or what is an implant? They just think it's a titanium pin. No, it's not. It's a titanium pin and the crown. So they're two separate things. Okay, now let's go through each option and go through the pros and cons of each option. So with the denture, as you know, it's a temporary fix. So say for example, a front tooth falls off and you're like, oh my god, what do I do? Just go in, get a impression. So that's like a mold from your dentist, and then we can do an immediate denture. So basically what we can do is we can just give you a denture, and the denture just sits and it clips on. Normally it takes a few hours to a day turnaround time. So make sure you call in as soon as you think you need one. Okay, now the good thing about a denture is it's cheap, it's quick, it's fast. We are not doing any surgeries, we are not prepping the teeth on either side. So that way it's it's simple, it's cost effective, and especially if someone who's very scared of the dentist, or they haven't been to the dentist for a long time, they need something straight away, that's the way to go. Okay, now what is the downside of it? I mean, yes, we can't have everything cheap and cheerful, and obviously there has to be a downside to it. So the downside is it is still a plate. Now I keep telling my patients, it's still a plate. Don't expect it to be fixed. Don't expect to be eating steak with it. It will move, because what it does is we've got clasps around. So can you see that there are some clasps around the teeth that actually they're hooks, and they hook on to the denture. Okay, so they hook onto the teeth, and part of it, the denture sits on the gum. Now for example, you might not have that many teeth. Yeah, so for example, your mouth might look like this. You might have few teeth left. Now where will the denture sit or grab onto? It will grab onto some teeth, but it will also sit and take the support of the gums. So there will be some movement when you eat. All right, a lot of people then end up using glue to just sort of put that in a denture adhesive and that in. They manage really well, but for some people there's a lot more expectations, so they'll say, well, I'm sorry, but I need something more than that. So obviously they'll look at other options. So who can have a denture? Basically anybody can have a denture. There is no really from a health point of view if there's no issues or contraindications as to who can or can't, who can wear a denture. So mostly everybody can, but obviously the expectation of the person as to what the denture can do, that's where they make a decision to go for a fixed treatment option. So what is the next option, the treatment option? So just make sure, just with what it's made up of. So some people is asking me, what is the denture made up of? The denture is actually made up of acrylic. So some people may have an acrylic allergy, so just be mindful. And there are two types of dentures. So one's a plastic denture, which is an acrylic denture fully made up of acrylic. Again, it's more cost effective than a metal denture, but the problem is that it can break, and that's people don't like a lot of plastic in their mouth, whereas a metal, it's more sturdy, so it doesn't break that easily unless you drop it. There might be a minor chip, and that will last you longer as well. So what you saw was a metal denture. So let's go on to a bridge. So what is a bridge? Now the bridge was very popular before, especially if you're missing a tooth. So a bridge is still okay option if you have a single tooth missing in the front of the mouth or slightly at the back. But what we need to do is we need to drill the teeth on either side. So the teeth on either side, just here, they act as the anchor, okay? But to do that, we'll have to drill them down. So they might be very good teeth, no issues with them, and you're actually preparing the teeth, drilling them down, and then you are giving them a bridge. Now, it's basically the appointment time. You have 2 appointments, where the first appointment is we prepare the teeth, we temporize the situation. Say, for example, if we want to, it's an aesthetic zone, we temporize. What temporize means we give you this when you come in, okay, but it's made up of a temporary material. So when you walk out, you've got a tooth in the front, because you don't want to walk around for 2 weeks without a tooth. Then we take an impression, okay, and we fabricate it. Now actually in our practice, we can digitally scan your teeth, so we don't have to take impressions, and it goes away to the lab, it comes back, and then we actually cement it. So that's a 2 appointments. So the first appointment is where we prepare your teeth, and the second appointment is when we issue or cement the bridge. So the only downside to the bridge is, as I mentioned to you before, is the fact that we have to prepare the teeth on either side. Now these days we don't want to touch the teeth if we can avoid that, because we want to do preventive dentistry more and more. So that's the downside. And later on, you need to sort of take care of it a little bit more. There's some special brushing techniques. We might have another webinar on that one, where we actually ask you to use super floss and keep that area clean. So how long will a bridge last? Now the bridge lasts, the research says, around 12 to 15 years. It can last longer than that, but you need to take care of that. So you need to come in and you need to get it checked, make sure you're brushing and keeping everything safe. Now there are other issues which can happen with the bridge. Again, we can talk about it another time, okay? So contraindications for a bridge. Now if the teeth are not solid, so if the teeth have a weak foundation, there is no point trying to grab onto them because they are weak, so the bridge is going to fail. So that's a major contraindication for it. And if you have any gum disease, obviously, so the gum disease or a bone disease is a big issue. And if these 2 teeth are also heavily filled, then they're also compromised as well. So again, we need to take a clinical decision. Sometimes if we do have heavily filled teeth or root canal teeth, we might use them. That's okay, but if it's heavily filled or if the prognosis is not that great, then there's no point in actually having a bridge, okay? The last one is the implant, which is the most popular treatment option, especially for a single tooth replacement. So what we do is you come in and obviously you have something there if it's a front tooth or and then you might say, well, I'm actually ready for something more permanent. I don't like this denture. Let's look at some options. So we first take a CBCT scan, which we can do that here at the practice. So basically we take a CBCT, it's a 3D imaging of your bone. What it tells me is it tells me exactly how much bone you have, so exactly where I can place an implant, whether it's suitable for me to place an implant. So what we do is we take all the data, we have a look at it, and then we can decide whether you are a suitable candidate or not. But even before that, we just go through pros and cons. We go through if the implant is a good option for the candidate, because implant is actually a surgery. So when there is surgery involved, we want to make sure that the patient is there's no contraindications. So contraindications, for example, can be if you are diabetic, and if your diabetes is not under control, or if you have some autoimmune disease, or you have you're immunocompromised, or the tooth has been missing for an extremely long time, if your bone is not that great, then there are ways to go about it, but it's best that we sort of understand. So first thing we do is just take a basic x-ray, just so that we know the width, this general idea about the other dentition. So if your teeth are failing, the other teeth are failing, what we don't want to do is to actually if the teeth are failing, is to put a nice brand new implant, because we need to sort of factor in that the other teeth are failing. We also need to factor in whether you're smoking, and if you're a heavy smoker, a heavy drinker, and also how do you go to the dentist regularly, because people expect to have an implant and that's it, and not come back and see us. So anything which you invest in, you need to also have regular dental care. Regular dental care is a must, but if you do want to invest in things like implants and a bridge, you need extra care as well. So what we do is we actually schedule a time. Say for example, everything is good, your bone is great, no issues medically, you're a motivated patient, then we can go ahead with the implant surgery. So the implant surgery is one where we actually drill and put the titanium pin in. Now you can't see that. Basically we numb you up, we put the titanium pin in your bone, and we allow it to sort of osseointegrate for 3 to 6 months depending on your case. And then the second stage is we put a crown. So the time you actually start the implant process or the inquiry, traditionally from the time you start to the time you finish, it might take you up to 6 months. Now there will be another session on implants, types of implants, how quickly we can do it these days, and that more details. But for today I thought I'll just let you know what an implant is. Now, so for example, if you're missing multiple teeth, you don't need implants to replace every tooth. We can actually design it such a way that we can actually put, like say for a full mouth, we can put 8 implants if we can, and then we can do a bridge as well. So there are ways to go about it. There's so much more details, so we can sort of go through the options with you. Well, I think that's enough for today. I think I've given you everything, a little bit of information, but please let me know for the next Facebook Live what you want to know. So if you can give me some topics if you're interested in, I'm sure I can come up with another Facebook Live. Thank you so much. Have a great day. Now, because you've been before I go, I would like to sort of offer a 5 free virtual consultation. So what we are going to do is we will actually, we'll ask you to sort of, log in and sort of enter your details. So if you win and if you're eligible, we can have a free virtual consultation. Thank you for watching. Bye-bye.